I'm Robin Marshall. I'm with K104.7, and I have Dr. Klein with me today with Renaissance Plastic Surgery. He's going to answer so many questions that you've been dying to know about breast augmentation. Honestly, you've wondered about it. I know I've wondered about it, but I've never known who to talk to about it. So I'm grateful to have you here, for me as well as for them.
Sure. We'll go over it.
I'm not even sure where to begin to ask. I know that there are different things, different ways to go about, reasons why people ask for them. What is the right reason to have this done? Versus what is the wrong reason?
Okay. Well, I think there's a number of reasons why women want to be enhanced, for their shape. I think some gals have just never developed to where they think they should be for their figure. So the person that just never got past an A cup. A lot of women, and probably the majority of what I see in my practice, are the moms. Moms had whatever cup size before they started having children. They breastfed 2 or 3 kids, and now they're a little washed out and maybe a little saggier than they used to be. But the breast sort of, as you age, and particularly after pregnancies, it gets larger during the pregnancy, but then involutes or shrinks. For most women, not everybody. And they want to just be back where they were, and by the way, how about a pinch more? And that's what I usually hear. And then the last thing would be, some gals with very large breasts just get too long, and they need a lift. And what I have found in my practice is that it's not so much that where the bottom of the breast is, but how it looks above the bathing suit and the bra, in that so-called cleavage area. And sometimes even for somebody that is full-breasted, we might do a lift and put a small implant in to give them the best shape possible above the bra line in that V-neck, without having to rearrange their bra all the time.
And now, the fear that some women have between the two different materials, silicone and saline.
Right.
What is the difference, and is there something to be afraid of?
No.
Okay.
In a word, no. It's a very convoluted story, but in essence, in the early 90s, there were questions about whether silicone gel implants were safe. Silicone gel implants were started in around the mid-70s. And there was no scientific evidence they were bad, but there was no scientific evidence they were good. So in a nutshell, through all scientific research, not done by plastic surgeons, not done by the implant companies, but by independent scientists, have shown without a doubt they do not cause all of the so-called autoimmune or connective tissue diseases like arthritis, lupus, scleroderma, hair loss, memory loss.
That's all the fear and everything I had been hearing.
Right. And we couldn't say that they didn't cause it, but there was no evidence to say they did. We have evidence on both sides now. They definitely don't cause it.
And you've had about 20 years now to be able to...
Exactly. And that was right when I've been in practice 18 years, that's right about when it started, was when I started my practice, implants sort of went away. As of 2006, in December, the FDA, which governs uses of medical devices, approved silicone gel implants for use across the board, reconstruction or cosmetic.
Isn't that something?
Yes.
So you had an uphill battle the first few years.
Right.
Because there was nothing to
we had the saline.
Measure it against.
We had the saline. And in general, they're really, to your body, there's nothing different. The shell or the implant itself is silicone rubber. And that's never changed. The inside is either salt water, which is IV solution, or a silicone gel that just hasn't been cured to the rubber yet. And so it never really made sense to me that if the silicone was bad inside the implant, but the silicone rubber was touching you,
how is that?
It doesn't really matter what's inside it because the silicone. So in essence, they're safe.
Well, I have a couple samples here.
Sure.
So this one is
the gel.
This is gel, and if you feel it, it feels squishy,
mushy.
But I don't know what's politically correct to say here. And this one is
saline.
All right.
That one is colored by food coloring.
No, ladies, you don't get to pick your own color. That was the first question I asked.
Right. We color them because we have different styles or shapes. Some are more projecting forward and not so wide. Some are wider and a little flatter. And so it's very difficult for patients who are getting a lot of information during their consultation to remember which style they like. So we usually say, do you like the yellow ones or did you like the blue ones?
Okay.
And so that's food coloring.
All right,
But this is an actual implant that would be implanted in you.
So if you feel these women, what I'm saying is this one feels more natural. Well, I don't know if natural is the right word, but it just feels like it's got less bulk to it.
Mm-hmm.
This feels heavier. Well, are they the same size?
Those two may not be, but they're pretty
Okay.
close.
It has a different feel, but what is the difference if it's in you?
Okay, good question. Looks-wise and shape-wise, we have the same one, same different shapes, same different sizes in both types. And the difference for me to talk to a patient about is if a patient is exceptionally thin, very little body fat, very little breast tissue, I can count all of her ribs, the gel is probably going to be my recommendation based on the texture that she feels as she's washing and dressing and so forth. And also, one of the potential problems is scalloping or irregularities around the edge. And when you have no body fat and no breast tissue, we might see and even feel those a little more obviously.
I see.
Generally, we're not in a topless society, but you are taking showers and seeing yourself in the mirror,
Right.
so we want them to be looking good all the time. The saline, if someone has more normal body fat, good muscle structure, and fuller breast, they just want to be fuller for their own reasons, we might put the saline in. And the difference to the patient is that gels from the manufacturer cost more.
Sexually, once this is inside of you, does it change what the woman feels when she's involved?
No, the woman probably does not, because it just becomes who you are, and that is your normal feel.
So it doesn't affect the outside of the breast? It's
Correct.
Okay.
Basically, they become you, and you perceive them as something new for a while, and after about 2 to 3 months, they are just part of your body. They are your breast, they are your arm, they are your knee. They're not consciously separate from you.
I was just wondering if it affected the nerves.
It certainly can, and that is about 10% of the time. And it is across the board. It doesn't matter which implant, doesn't matter which incision. It can be the smallest implant that we can use, and it can be the largest. It really does not matter. It is a unique sensory nerve, unique to each woman. In general, across the board, 10%, usually one side, and the other side usually is okay. Hard to predict. There's no way to predict.